Hello everyone and welcome back. I'm so glad you're here. Today we're going to talk real briefly about how it's a win-win situation and how important that is when it comes to healthcare. I'm out here in my backyard, so if there's all kinds of wildlife back here, there's a creek back here. So if you see a skunk or a snake or something like that come up behind me, by all means, tell me. Just yell, snake or skunk, so I can get out of the way. Thanks for the hat, the shirt, and yes, stronger than the storm. I promise you, if you can get through the storm, a few raindrops won't bother you. I promise you that. So I'm going to talk briefly about a win-win situation, and I had a few questions on the radiation that I'm almost done with, actually. But real quickly, when you go for job interviews to corporate America, what do they all ask you? A lot of them give you a personality test. A lot of them will ask you this question. If you're driving down the road in your two-seater car and you come up to the corner, there's a bus stop. And at that bus stop is your best friend, a little old lady who needs to get to the doctor, and the person of your dreams, somebody you've been wanting to meet and talk to for a long time. And it's pouring rain, but your car has two seats and you're in one of them. What do you do? Now, I'm going to give you the answer to that in just a little bit. But if you've ever been to a few job interviews in corporate America, you get asked that question. And I'm going to give you the right answer to help you maybe get that job. When I talk about win-win when it comes to, well, you know what? First off, let me answer those radiation questions. And then we'll finish with the win-win because we'll answer that riddle. I am not getting live radiation. Live radiation is radiation that is in process at the time, which is like a CT scan or an X-ray. And there's different natural live radiations, like gases out here behind me, probably like radon. And I have had a lot of CTs and X-rays, especially lately. But the type of radiation that I'm getting to treat my cancer is external radiation. So they'll shoot a beam in me. I'll hold my breath for 20 seconds. They shoot the beam in me. I breathe. I hold my breath for 5 or 10 seconds. They shoot the beam in me. I breathe. And that happens a couple of times. So it's about a minute, maybe 2 minutes at the very, very most. I haven't timed it. And that's all the radiation I'm getting. And they prescribed it 15 times. So I go every day, and I've started it. I'm about done, actually. Some people get a lot more radiation. Some people get internal radiation, which are like seeds that they implant in you. Prostate cancer, some breast cancers will get this type of radiation. It's like a little grain of rice, and they implant it in you, and it's a radioactive seed. Some physicians will tell you that it's very confined and you're not radioactive. Most of the pamphlets that come with the different types of radiation and the type that you're getting, that doctors will give you, will tell you, though, if you do get those radioactive seeds, to play it safe and not to be around pregnant women or little children, to keep your distance. So anyway, back to the win-win situation real quickly. If you have hypertension, then you understand that hypertension is easier to treat and less expensive to treat than a triple bypass. Okay? So getting your screenings, your mammogram, your colonoscopy, having a doctor look at your skin moles, things like that, getting your pap smears, that's all cheaper than cancer. And if they do find something like precancer cells or stage 1 cancer, that's easier to get through for the patient, it's easier to treat, and it's less expensive than stage 3 cancer. Okay? When I took my 12 weeks of chemotherapy for my stage 1 cancer, I did it. It was an option to me. It was highly recommended, but it was an option. I could have said no, because when they took the tumor out, the margin in the lymph node was benign, so they got the cancer out. I just didn't know if there was any cancer cells or precancer cells or microcells in my blood. So chemotherapy became highly recommended, and I chose to take it. Since I chose to take it, I did have to pay my copay every week for 12 weeks because it wasn't considered medically necessary by the insurance company. Although there could have been precancer cells in me. All right. So, anyway, 12 weeks of chemotherapy for 1 hour a week is a lot better than some patients I spoke with who had stage 3 cancer who went home with a pump. And that pump, they got chemotherapy in the infusion center, and then they went home with a pump that pumped chemotherapy in them for another day or two. Then after that, some of them told me that they had to give themselves a shot in the leg for the next 5 days. And then they had to come back, the following week and do it all over. Some people have said they've been getting chemotherapy for a year. So, the win-win situation, if you get your screenings, and if something is caught, it's probably caught early if you get your screenings on a regular basis. That's a win-win for you because you don't have to go through as much treatment as someone who did not catch it early. And it's cheaper for your pocketbook, and it's a win-win for the community if you're someone who needs extra provisions that we provide with our taxes, like if you're on Medicaid, or if you draw Medicare because you paid into it for years and you're on Medicare, or you're disabled and you're on Medicare. So it's a win-win for the community as well. You win, the community wins. So please, catch it early. Get your screenings, okay? Now, back to that quick question, because I want to keep these videos short. What do? You're driving down the road in your 2-seater car. It's pouring rain. On the side of the street is a bus stop. There stands your best friend, a little old lady who needs to get to the doctor, and the person of your dreams that you've always been wanting to meet. What do? The answer is, you stop your car, you get out, and you hand your keys to your best friend, and you say, please drive this little old lady to the doctor. And you stand there on the side of the road with the person of your dreams that you've always been wanting to meet and get to know. And that is a win-win-win situation. So whenever you're faced with any situation, your health care, every decision we make today affects us tomorrow. Whether we decide to get a screening or not, take our mammogram or not, take that high blood pressure medicine or not, eat that sandwich or eat that fruit or eat that veggie plate or not. Every decision we make today affects us tomorrow. So before you decide what you're going to do, like right now, I'm tired. I want to take a nap, but I know I need to go for a walk. I know what will help my fatigue is to go for a walk. So every decision we make today affects us tomorrow. So I just ask you, whenever you're faced with anything today, whatever decisions you make, to eat that candy bar or not, to go for a walk or not, think about the win-win. Think about, should I pull my car over on the side of the road when it's pouring rain and I have a 2-seater? Think about that. Okay? That's our show for today. We're going to try and keep these videos short. I will be back. I'm going to do a series, environmental series, on microplastics, your cell phone, radiation, radon, different things like that. So I'll be back. If you have questions, please shoot them to me like always. And thanks so much for tuning in. Have a super day.